I have friends, colleagues, members of my hospital who cry before they come to work, cry when they leave work, because the workloads are so high. They are not providing the care that they were trained to give. We are morally injured, and it cannot continue.
Canada's healthcare crisis is coming to a head on Parliament Hill. NDP leader Jagmeet Singh calls the federal government's response so far as, quote, deplorable. He's demanding Prime Minister Justin Trudeau sit down with the premiers to address the immediate crisis, and he's not ruling out withdrawal of NDP support for the Liberal government. NDP leader Jagmeet Singh joins me now. Mr. Singh, thanks for coming in.
Thank you.
The Prime Minister has yet to sit down with the premiers, but he sat down with you this afternoon, I understand it. Did he give you any assurances on healthcare that make you more comfortable than this morning when you spoke?
We raised a concern. I wanted to make it very clear that this is very serious, and we put it on clear notice. We put the Prime Minister on notice. I put him on notice personally that this is something we need to see action on. In 2020, it was our seniors in long-term care that bore the brunt of the pandemic. The military had to get called in. Now this is early, in December, with the early season of the respiratory diseases that we know happen very often in this season. And already the Red Cross has been called into Ottawa, the nation's capital, in the Children's Health Hospital. In Alberta, we have trailers set up to deal with the overflow in the Children's Hospital. Children are dying. It is serious, and it's only going to get worse. So I made it clear that we need to see action. We need to see federal leadership.
Did he give you any indication that there would be federal action forthcoming, or meet the bar of leadership that you're demanding?
So far, I put him on notice, and I did not, at this point, receive what the action will be, but I made it clear that's what we're looking for. We need to see action.
If they're so absent on this, I mean, why threaten to withdraw support for the agreement? Why not just do it if they're doing such a bad job on healthcare?
Well, when I look at that question, I think about what it means is giving up, and I'm a fighter. We're 9 months into this agreement. We've used it to get significant victories for people, and I don't want to give up now. I want to keep on fighting. There may come a time after we've exhausted all of our efforts of fighting, we've raised concerns, and there's simply no action on the part of the government, then that is an option that we have. But at this point in time, we're fighting. We're using our power to get this government to deliver on the leadership that we need to see happen for people to get the health care they need, particularly our children right now. And that's what's really heartbreaking about this. It's children that are bearing the brunt.
Yeah, but you've put them on notice. You know, my whole life, when I've been put on notice, that comes with a deadline. So what's the deadline here for Prime Minister Justin Trudeau to live up to the standard that you're expecting him to live up to in this healthcare crisis?
Well, we let him know that this is what we're expecting, and the ball is now in the Prime Minister's court. We're going to continue to share the stories that we're hearing from people and continue to fight to see some action happen. It is insufficient that the current response is the premiers want money with no strings attached. The Prime Minister wants to put strings. And we have support that people want to know where money is going, and it should be going towards healthcare. And there's some serious concerns around premiers like Daniel Smith and Doug Ford who will use the money to privatize healthcare. So I understand that. But to a family right now that is worried if their kid is going to be able to get looked after, that is not an answer that gives them any solace.
I understand that, but I guess that then goes back to my point that the need is now, the crisis is urgent, so that makes it time sensitive. So putting the Prime Minister on notice means what exactly if there isn't a deadline by which action is required when you follow through on what you threaten him with here? We're
letting the Prime Minister know this is important, and we're raising the stories and concerns of people.
He knows that's important, don't you think? I mean, he must know. He hears it from his MPs. They hear it. I mean, he hears it on the news and from the premiers. I mean, he knows it's important. I guess the question is when does he need to act by?
Our priority is to get results. And we've been told in the past no when we put something forward. And for example, in May, we said Canadians need some extra help, and we suggested increasing the GST rebate. The Prime Minister's answer at that time was no. The Conservatives came out opposed to it. As of the 1st of December, or as of November in 2022, Canadians started receiving twice what they received in terms of their GST rebate. So we didn't give up fighting. Similarly, right now, we're at the beginning of this crisis. Mm-hmm. It is the beginning of the season, and things are only going to get worse. We've raised this as a serious concern, and now we're letting the Prime Minister know we expect action.
What they're looking for, the conditions that Minister Duclos has been the main spokesperson on, these are all baked into the agreement. I've got to hear that you signed with the Prime Minister on the confidence and supply agreement. So, you know, wanting mental health support, aging at home, better data, this is one of the sticking points in the conversation. So that's part of the agreement you signed on for. So do you support the federal government in holding on to these conditions and expecting progress on those key areas from the premiers in return for billions in extra money?
We've always said that if we spend money Canadians expect us to know where that money is going. The idea that it should be going towards clear outcomes, better improved healthcare delivery is something that Canadians expect is reasonable, and I agree it's reasonable. But what I don't think is reasonable is in the face of a healthcare crisis where children right now are bearing the brunt of it, with children's hospitals across the country at breaking point situations, overcapacity, in Montreal, in provinces across this country, in Toronto, in the capital city of Ottawa, in Calgary, places where I visited. In that point, when we've got such a serious crisis in our healthcare system, what we expect is some immediate action to deal with that problem. That's what we're looking for.
So what does that immediate action look like? Because the federal government is one part of this conversation, and there are 13 provincial and territorial premiers on the other side of it, and they have been asking for money without conditions for years now, and kind of torpedoed the health ministers' meetings that were happening in Vancouver by putting out a news release before it was over saying it was a failure. So I mean, what does meaningful action look like here, and how do you hold the Prime Minister to a standard if you don't also hold the premiers to a standard, I guess?
Well, we certainly agree that the premiers aren't doing their part. There's no question about it. We've got premiers that are failing. Abject failures. Doug Ford is a failure. Daniel Smith's been a failure. And we see that they have money that they could be spending on healthcare and they're not. And there's no question about it. They are failing people and they want to privatize the healthcare system. Knowing that, it is wrong to sit back and watch that happen. So what we're saying to the Prime Minister is, we saw immediate action in the pandemic, steps taken that went beyond what we normally expect the federal government to do because it was such a serious time, the federal government stepped up. Similarly, right now, imagine the early weeks of the long-term care crisis where seniors were found in such deplorable conditions when the military came in. They said this is worse than what we've seen in war zones. We're at the early stages of that right now, based on what nurses and doctors and frontline healthcare workers are telling us. We're at the early stages of that. We're just starting with the flu season. It's just early stages of that. It's early stages of the respiratory season, respiratory illness season. So right now is the time to act, and we're expecting the federal government to step up the same way they did in the pandemic and come up with some solutions. We know that some of it's going to require using the immigration system to bring in healthcare workers. Some of it's going to require some immediate relief when it comes to making sure people can get medication over the counter, because a lot of people are going into the emergency room because they can't find medication to help with a fever or a cough with their child.
But during the pandemic, they were very responsive because it was a minority government, but it never had an agreement. It never had a partner. So the political pressure was issue by issue, day by day for the federal government to act. Do you think some of the pressure has been taken off them to respond to this crisis in an urgent way because they have this agreement with your party to keep them there until 2025, as long as dental and other things keep moving through the legislative process?
Not at all. It gives us an increased lever. It gives us more access, and it gives us more power than ever before. It doesn't mean that the government may fail to deliver what they promised to, and we've seen that happen in the past. But we certainly have more power now and more influence now than we've ever had before, more access to the ministers and more access to the Prime Minister to get them to do what's needed. But at the end of the day, the Prime Minister is still the one who has the final decision maker. That's who Canadians elected, and so we're going to put pressure on them and on the Liberal government to act. If they fail to act, it's on them.
Okay, but you've put them on notice, but without a specific deadline, and you say you want them to act. What are the specific actions? I mean, a meeting with the premiers doesn't necessarily guarantee that something gets fixed in healthcare. So given the jurisdictional splits in the country, what is it you want to see the federal government do right now that satisfies your call for an urgent response?
So the main concern that we've heard from healthcare workers is there's a human healthcare resource shortage. So meaning there's not enough healthcare workers. So what do we do to address that? One, we need to make sure that anyone in this country that has international training should be working in that field. And so to unlock that, there's a federal aspect of that. Many of the exams are national in scope for healthcare workers.
A lot of that's provincially regulated or professionally regulated.
And there's
right?
a provincial element as well.
Yeah.
So we need to see the federal government step up and find solutions so that these workers that are brought to Canada, that are trained internationally, that have experience, that their potential is unlocked, find a solution so that they can actually start working. Secondly, the Prime Minister made some big promises around making sure healthcare workers got better pay. He made a promise around personal support workers, for example. His commitment was to make sure they were paid appropriately. We want him to fulfill that promise because we know good pay will help deal with the healthcare shortage.
But that has to be done through the provinces, right? I mean, they provide the health services. That has to be done through private employers or government employers at the provincial level, and even accelerated credential processes is not going to solve the staff shortage for the current cold and flu season in a meaningful way.
Well, in terms of giving some additional supports, financial supports to get people working, We know that we've had tools to do that. There's ways and there's suggestions around tax credits to support and incentivize healthcare workers, those that have left the profession because they're not able to make ends meet, because they don't have enough resources working in that field, personal support workers who've left the field because they say we're not able to earn a living. There's ways to use the federal system to find some immediate ways to provide financial supports. We've done that before through CERB. We were able to give money directly to people.
Right.
So we need to find a way to support personal support workers. We need to find a way to support healthcare workers on the front lines, and we need to do it in as an emergency. When we're up against an emergency, I don't think leadership is to say, well, there's all these barriers and all these excuses. I think it's finding creative solutions in a time of difficulty, and there are ways we can do that.
Just one last question. If you do follow through on the, I'm going to call it a threat, maybe it's too strong a word, to potentially pull your support over this, are you talking about trying to force the country into an election, or are you talking about going back to the issue-by-issue parliamentary setup that existed prior to the confidence and supply agreement?
Well, we're leaving the door open. Our choices, we have many different choices in terms of the way we exercise that. It could simply be exiting, or it could be a confidence motion, but that's not our goal. And that, I want to be very clear, that is not what we're looking for. What we're looking for right now is to use the power we have to fight for better response to this healthcare crisis, and to force this government and force the Prime Minister to act. That's our goal, and that's where we're putting our emphasis. We, of course, have the ability to do a number of things in terms of how we use or withdraw our support, and we can look at those tools. But right now, our goal is to say, this is serious, and we need action.
Okay, Jagmeet Singh, thanks for coming in. Always good to see you.
Thank you.